Leslie Harris, women's fitness specialist. Welcome to the show.
Thank you so much for having me.
Yeah, of course. Well, before we get started, please tell us about yourself and who you serve.
Absolutely. I'm Leslie. I help women, especially moms, rebuild their core and pelvic floor after my own experience of, having kids. I wasn't educated on what to do with my body. I had diastasis recti, back pain, discomfort. I thought that I just literally had to accept. So, learning how to properly heal my own body changed how I train and coach other women. And now I get to help them feel strong in their core and pelvic floor so they can lift and move and have sex and live confidently without leaking pain or just embarrassment.
Yeah, this is definitely a very narrow niche, I would say. But I think what we should definitely start off with is you're coming from working on the pelvic floor
Mhm.
for women who are either pregnant or post-pregnancy, still with the issues. And we'll dive into what exactly that is for the audience. I'm coming from more of an outpatient physical therapy perspective. So I'm not specializing so much in the pelvic floor. That would be a separate specialization that people undergo after they graduate from PT school.
Mhm.
But a lot of similarities between core strength, core function, and glute health
Mhm.
between the two type of niches that we serve. So let's start with the first question. What exactly is the pelvic floor and why is it so important to your clients?
Yeah, absolutely. The pelvic floor is basically just a group of muscles at the base of the pelvis, in simple words. However, it is a part of the actual core system, not separate from it. So it works with our breath, our deep core, our hips, and our glutes. And in turn, it supports our organs, manages pressure, and it helps us transfer force during movement, everyday movement. So it if the pelvic floor isn't functioning well, everything above it has to compensate in some shape or form.
I see. And the compensation is something that I see all the time in physical therapy. There's this concept called the kinetic chain. That means if you have a knee issue, and you're working with a physical therapist, almost every single time, they're not going to just look at the knee during the evaluation. They're going to look above and below the chain. How is the ankle working? How's the ankle moving? Is it moving at all? Same thing with the hip and the lower back, because if one part of that kinetic chain is not working, then that compensation happens somewhere else where short term, that's fine, but long term, that leads to a lot of issues.
Right.
So tell us, Leslie, what are the common pain points, common symptoms that your clients and the women that you work with complain about when they have a dysfunctional pelvic floor? What does it kind of prevent them from being able to do?
Yeah, well, from a mom's standpoint, jumping on trampoline with your kids is like a big one that I've dealt with personally. I see it a lot in other moms, but just having that fear of the leaking, jumping, running, lifting heavy, a lot of times just avoiding maybe intimacy because sex becomes painful, embarrassment, just in general with, I'm at the gym in a group training session and I have to run to the bathroom because I'm about to piss myself. But really just anxiety around leaking, the back pain, around having maybe another pregnancy happen, just feeling broken or like the body just has betrayed them, if that makes sense.
Absolutely does. How common is this for the average woman that gets pregnant in their lifetime? And how long do these symptoms tend to persist for?
I would say at least 80% of women experience some sort of diastasis recti, any of these symptoms listed to some degree. However, I would say it depends a lot on how educated they are. Like some women do know the basics just because of their environment, or maybe they have some sort of degree or have been educated to some point, but I've learned that it's very rare that we just don't know what we don't know. So I would say 80% of women, and then these symptoms, just depending on what you do know or don't know, can last. I mean, I'm 8 years. My youngest is 8 years, and I'm still learning things. So, I mean, it really isn't just a freshly postpartum symptom or symptoms. So it can last a while.
Mhm. This isn't something that I feel like most people are aware of or even talk about. That's coming from a man's perspective.
Mhm.
Is there a reason behind that? Like, why is this so hush hush?
I've asked myself this question for years because it has led to so much frustration and tears just on my own journey. I really don't know an answer to why it's not talked about enough. We're having these kids in a hospital room, not told anything besides you need to go poop before you leave. And then we come back in 6 weeks and tell the doctor how shitty we feel. Oh, you're a mom now. It's normal. Like there's no education to us at all. So I don't really have an answer to why. I don't know.
Yeah. So the main things that you're talking about there is incontinence, which is the inability to voluntarily control bowel and bladder
Hmm.
movements, which can absolutely be very embarrassing or anxiety provoking. But there's also the pain aspect with anything that requires abdominal bracing from lifting to playing around, jumping around with your kids. And
Hmm.
that's a very common thing that young mothers have to be able to do right after pregnancy. Now you have this kid that wants to do stuff and you're unable to because it hurts to do it.
Hmm.
What are some of the things that someone can do to help with that incontinence and the pain?
Well, in terms of incontinence and the pain specifically, I think that really leads to learning how to just breathe correctly, coordinating that breath with movement specifically, and really just learning how to train that pelvic floor and whole as part of the whole core, like the whole picture, because progressive loading needs to be done intelligently, I guess you could say, because it is a very compensatory symptom after pregnancy. We learn to trick our body into different like postural things, not learning to use our pelvic floor. And so after pregnancy, it's it stays. It's like engraved as a habit. And so we don't know how to undo any of that, if that makes sense.
So that's kind of along the lines of motor learning, which
Almost.
kind of
Yeah.
answers this question, but I just want to clarify for the audience. When it comes to physical therapy, whether it's pelvic floor, shoulder issue, back pain, knee issue, it boils down to one or a combination of two actual impairments that's going on. It's either a stability issue, meaning that they're too weak, they need to strengthen,
Hmm.
or it is a tightness issue, which there's a muscular imbalance with the tightness, and you need to stretch the muscles that are tight to help with posture. Is this one or the other? Does it err on one side, or is it often very much a both scenario, and it's truly a motor coordination issue that you're seeing?
I would say it's truly both. I once had a physical therapist tell me that your brain doesn't know to work a muscle unless it knows the muscle is there. And so many women don't know that their pelvic floor is even there. And so it's, what's the word? It's like pulling all these different muscles to compensate in some shape or form. So it really is about retraining the whole system, your brain to body connection, like all of it.
Yeah, yeah. I'd imagine for someone who's not regularly thinking about this kind of stuff, if you've never seen the muscle, you can't really see the pelvic floor,
Exactly.
then you're not going to realize that's a thing. Your brain might turn that off. And we'll definitely talk about how that translates to glutes. There's this concept
Mhm.
called gluteal amnesia. I like to call it sleepy bum bum syndrome.
I love it.
Yeah, but it's not that the glutes are weak per se, but your muscles are not being active when they need to be because your brain has failed to recognize the importance of integrating them into motion. What are your thoughts on Kegels?
Mm. Kegels are an iffy one for me. For years, I was told just Kegel, do like 100 Kegels a day. It'll help your pelvic floor get stronger. And really, just from my personal experience and working with so many women at this point, Kegels, they end up causing a hypertonic pelvic floor. It's extremely tight. And then what happens is these women and moms don't know how to relax their pelvic floor because they've done so many Kegels that it's just tight, 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 tight. So many women are already overactive. So that strength without the relaxation standpoint is just dysfunction. It's dysfunction all over the place. So Kegels don't teach timing or pressure control. They're not bad, they're just incomplete for most women.
I see. Just for the audience, Leslie, do you mind just describing to us what exactly is a Kegel? And I'm assuming if it was as simple as doing Kegels to solve this issue, and so many women wouldn't be having this issue. But what exactly is a Kegel?
Kegels are just the basic contraction of the pelvic floor. I mean, it's just that simple pull up and down. It's almost like you're pulsating the whole bottom piece, I guess you could say, of the pelvic floor. But really, it's creating that. It's almost like lifting a weight, but it's just constant, 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 and it's never relaxing it to where the pelvic floor and the core system can finally like breathe, relax, and then get that strength on top of that.
Yeah, I think this is what likely makes treating the pelvic floor, especially post-pregnancy, postpartum, such a complicated issue. Because if it was as simple as just strengthening, Kegels all day long. It's just like a
Yeah.
bicep. But to your point there, it's not just a strength imbalance. That could be part of it, But the
Mhm.
ability to relax is also equally as important as the ability to contract. It just depends on the context, right?
Mhm. Absolutely. Yep.
Okay. So Leslie, how long is something like this? If someone in your shoes before you figured it out were to do everything right, how long do you think it would take them to actually start to feel better from a symptom perspective?
I would say some awareness changes can happen within just a few weeks. The strength and coordination aspect, I would say, would improve over some months. I mean, it's rehab and performance, not really a quick fix, just like with anything. So it really just depends on that person, how much, time and effort they're putting into just the basics, because it's boring. It is so boring to, heal and strengthen your pelvic floor. But, early wins that I would say my clients notice is the less leaking, less pressure or heaviness that a lot of women feel, better connection to the core, better posture, even better confidence in the lifts, just feeling in control again.
Are you saying the first thing that people or women tend to notice first once they start to improve is simply the awareness of their pelvic floor and how to control it to a better degree, which I'm assuming would allow them it's not necessarily that it's stronger, right? Again, it's not a Kegel issue, but if you were to go and lift something, perhaps before you were aware of your pelvic floor, you just lift it without engaging any sort of muscles. But now you have that at the forefront of your attention. You know how that kind of works, how that feels like. So you're able to stabilize that bottom part of your pelvis before you do a lift. And that alone tends to help with a lot of symptoms from pain to incontinence and et cetera.
Yep,
Yes.
100%. Just the awareness that it's there, and you're like, oh, I may need to like, tighten or embrace this before I lift the car seat or whatever it is.
Mhm.
It's huge, huge.
Yeah, yeah. And I'll definitely say from a physical therapy perspective, this absolutely leads into posture and postural muscles. Because as you were saying, before pregnancy, and if you're young and fit otherwise, you're not going to have a problem with this per se. It's after pregnancy, you've unlearned that, but it stays unlearned with the whole motor recruitment failing. And until you purposefully, intentionally relearn it, it's not going to get better on its own, right?
Yeah.
Okay.
Yep.
Let's talk about posture and specifically about the pelvic tilt. What are
Mhm.
you seeing when it comes to postural impairments along your population?
Yeah. Once we start talking pelvic floor, posture always comes into the conversation. And this was one thing that I was aware of to a degree, but now that I've learned so much about it, it was like, wow, like this is huge, huge. So the anterior tilt, it obviously comes from pregnancy or prolonged sitting, but the pregnancy is where, like you said, we unlearn everything. And so we're automatically in this tilted stance to compensate for the belly. After the baby's out, we tend to still do that, which in turn creates poor breathing mechanics, weaker inhibited glutes, overactive hip flexors. And so this creates poor pressure management, lower back pain, no core engagement whatsoever because we're compensating in that tilt 100%. And it increases the pelvic floor strain so much that it's so hard to unlearn from that tilt.
I think a good thing for us to kind of explain here is what the heck is this anterior pelvic tilt that you're talking
Yeah.
about?
Yeah. So it's literally when you're from pregnancy, you're pushing forward from the weight of the baby. And so it makes like this arch in your back. Almost, I like to tell my kids this example of the Grinch. Exactly how he stands in like the movie. That is exactly what the tilt looks like. And so your hips are pretty much out of alignment of everything. So your hips and ribs, nothing is stacked anymore. You're curved in. Does that make sense? Answer the question a little bit.
Yeah, yeah. I just was wondering what your take on that was for your population specifically. Now, in the physical therapy clinic and working in outpatient practice here, anterior pelvic tilt is absolutely way more common, especially in women based on anatomical differences compared to men. But from an orthopedic standpoint, what it means is you have the pelvis, this is the front, and this is the back, and anterior pelvic tilt, so this is the front, this is the back, it would be so that in a standing position, you're
Mhm.
naturally, your pelvis is forwardly or anteriorly tilted often due to a muscular imbalance. And this guy that's famous in the physical therapy world, I think he's passed away now. It was a really long time ago. His name is Yanda, Jandas, Yandas lower cross syndrome, kind of explains this, why there's a muscular imbalance. But essentially, when we're talking about posture, there's muscles that are all attaching to the pelvis in different ways and pulling on that pelvis in different ways. You need a balance of those pelvic muscles so that it's pulling at an equal amount. If there's an imbalance, that's where it's shifting that posture. So
Hmm.
the main muscles that are kind of involved there from a physical therapy standpoint is the erector spinae muscles, which are the muscles in the lower back,
Hmm.
the quadriceps and the hip flexors, those tend to get tight. And in physical therapy, tight and overactive are more or less the same. So they're pulling it forward. The only real two muscles that can kind of pull it in the other direction to get that neutral posture is going to be the hamstrings and the front core muscles, the rectus abdominis, the transverse abdominis, the
Hmm.
abdominal muscles. But in pregnancy, what happens? We have diastasis recti. It
Yep.
opens up. And even with a C-section, it's probably worse. They're literally cutting you open. The
Yep.
muscle is going to be weak. It's going to stay weak unless you do something about it. And now you're
Hmm.
stuck in this position. The problem of this, especially in women, is they're already prone to that anterior pelvic tilt position to begin with, just by simply being a woman. But you add pregnancy on top of that, and now you have these hormones like relaxin, estrogen, progesterone all going up and down. It causes your joints to get super loosey-goosey. So when you change the posture of the pelvic tilt, just like that kinetic chain that we're talking about, it changes or disperses the loads, the forces of your body weight on the other joints above and below drastically. And one day, 2 days, a week, not a big problem. But if we're talking about years, absolutely that's a problem because when you're shifting like this, you're relying on something that we call capsular support, not muscular support. Great way to kind of explain that is have you ever stood up and then you're locking out your knees, but your quads are inactive, and the only thing that's keeping you up is your knee joint locked out, right? Are you
Hmm.
following so far?
Hmm. Yeah.
The problem with that is if you only rely on the capsules, like the non-contractile components of your joint, the ligaments, and perhaps even the tendons, the cartilage, well, they're not designed to bear load like that all the time. You need the muscles to be the one holding you up for the most part, but it's that lack of it because of the learned weakness from the motor control, right? So I think shifting that anterior pelvic tilt more towards a neutral in the posterior direction often means stretching the hip flexors, stretching the quads, stretching the lower back, but really also importantly, strengthening the hamstring muscles and the core muscles to help the body not just get here, but stay here. Does that
Hmm.
make sense?
Yeah, absolutely. And I was going to ask, from your perspective as a PT, what do you think people or like clients that you see misunderstand most about that tilt?
It's that they are genetically designed like it. More times than not, it's a learned habit. And all your tissues in the body undergo turnover. So your cells today, your skin cells, bone cells, muscle cells, tendon cells, if you give it enough time and you're alive and you're doing a metabolism, the old cell will eventually get replaced with a new cell. Some cells do this faster than others. Now, when it comes to a contracture, meaning a tissue that has shortened its range because it's always been in a shortened position. For example, like if I had my arm like this,
Hmm.
for 10 minutes, I'm not going to get stuck here. But if I had it like this for 10 years, that's a little bit extreme of an example, but
Yeah.
just for the sake, for 10 years, yeah, it's going to get stuck here because the tissues in this aspect get lengthened and they stay lengthened. And then the
Hmm.
tissues here get shortened and they stay shortened. So the body, I mean, you have these joints for a reason. The joints are designed to move. It's the lack of motion. And even if there's motion, it's the lack of applying the right muscles at the right times that often leads to issues. That's the concept I would say with physical therapy. But this kind of gets me to think, how common is lower back pain in your population?
Very common. And I feel like it leads from pregnancy 100%, which goes into the postural, the alignment issue that comes about just from compensating with the weight of the baby.
Hmm.
But back pain is like the number one thing that I hear from women.
Yeah, that's pretty much expected because again, going back to the kinetic chain, your hip is right in the middle of your knees and your lower back. When you shift this, you've effectively redistributed your weight from muscular to capsular in not just the pelvis, but also the knees and the lower back, which is why pregnant women or right after pregnancy, if they don't fix this issue, tend to
Mhm.
have persisting lower back pain. I mean, you got to think like you got the baby right in front of you. You're basically wearing a backpack that's super heavy.
Mhm.
In front of you, your back muscles are pretty much the only thing that's keeping you up. Not to mention the glutes. Now let's talk about the
Yeah.
glutes, right?
Yeah.
What do you see with the glutes when it comes to your population here, Leslie?
I see a lot of women just complaining that ever since they've had babies, they have the mom butt, which is literally where it's tucked. They have no butt anymore. So, the a lot of women, it's just one of those things I don't think we know because we're not taught these things. But the glutes and the pelvic floor are allies. They kind of reflect off of each other. And so if one is imbalanced or weak, the other is going to be, imbalanced or weak. But I call it the mom butt because you think, when we're carrying a baby, car seat, whatever, we compensate forward in that tilt naturally. And so our glutes just kind of automatically go in with us. And so we're just all out of sorts in all departments.
Yeah, and that goes right in line with the concept of compensation
Hmm.
and gluteal amnesia, which is the technical term for losing the ability to use the glutes when they're supposed to be active, which is, for the most part, every single time that you stand up and do anything, they should be
Hmm.
active to a certain extent. But here's the problem, right? Your glutes, primarily the gluteus maximus, they do hip extension, the erection motion.
Hmm.
Well, your lower back can also do that to a certain extent. Now, when you're in that anterior pelvic tilt position, especially if you have a giant baby in front of you, yes, in the short term, you can compensate because that load has to go somewhere.
Right.
If your glutes aren't taking it up, well, what's the one muscle right above it, right next to it, that kind of does the same thing to compensate? Your lower back. Of course, you're going to get lower back tightness. Like every single pregnant woman is like, they're holding their back, they're in this
Literally.
position because they're
Yep.
in pain because their glutes are not kicking, right?
Hmm.
But then that also goes into the glute medius, which does hip abduction. So getting your leg outwards. That's
Hmm.
called hip abduction. I'm assuming part of your protocol when you're helping these women that have horrible back pain and diastasis recti, it's not just about doing a bunch of crunches and breath holds, but you also got to focus on the glutes, right?
Absolutely. The glutes, the inner thighs, it all ties in. And so that's like a big emphasis in anything core prescribed in my clients.
Are you often starting individuals with one-sided unilateral exercises or bilateral, like both at the same time?
I would say I try to have a good mix. I feel like the bilateral is just something that a lot of people have that misconception about. It's like, oh, my back hurts from doing these things, but it's like, yes, we're doing it for a reason. The bilateral motion helps those muscle imbalances and target those compensatory areas that you've been compensating with for so long. So I feel like I try to have a good mix. I wouldn't say I started out that way. I really try to emphasize the breath work because, again, if you don't know the pelvic floor is there, you don't have that awareness to really move forward with anything. So it's very foundational. But whenever we do get to that point, it's glutes, inner thighs, all tied in.
Yeah. Leslie, you're absolutely very much someone who's been through the process. Now you're helping other people with it. I got to ask, is what you're doing with the programming here for the women, is it a one size fits all approach? Like, do you have a proprietary blend that you're doing? Or when these women come to you and they need help, is it more of a individualized, your program looks like this because your issue is this, or your program looks like this instead of that one because your issue is something else? Is it one-sided or kind of the same thing?
Very individualized. Every woman is different. Every woman has a different story, you know, how they had their babies to how many years postpartum they are to what they do for a living. So it's very much individualized based off of what they're really, really struggling with and their pain points and how far deep they are with, diastasis recti or bladder leakage or just depending. It really just depends, but it's very individualized.
Yeah. And one more question, just we might as well clear this up. What the fuck is diastasis recti?
Diastasis recti is the abdominal separation in the core muscles. So you've got the transverse abdominis, the rect.
Pelvic floor review, very pelvic floor review.
Yes. Oh my goodness. So it's the gap in the lining, and basically all that pressure is going intra-abdominal forward, which causes it's like a chain of effect. Everything's open, you're tilted forward, your posture is horrible, your glutes are weak.
Yeah, so you have the transverse abdominis, which is like the innermost muscles, and then on top of that, you have the obliques, the rectus abdominis, the
Yes.
six pack muscles. But that six pack gets split
Yes.
down the middle, even if you don't necessarily have a C-section, evolutionarily that makes sense because the baby has to go somewhere. Your tight
Mhm.
abs can't be right on top of it. But now, after pregnancy, you're left with this giant lengthened muscle. And in physical therapy, the opposite of tight, which is overactive, is lengthened, which means it's often underactive. Weak pelvic floor, lumbar lordosis, hyper anterior pelvic tilt, back pain, knee pain, it all just comes together.
Yep.
Yeah. Well, Leslie, this was fantastic. If a woman who's struggling with these issues, like she's tried it, been there, done that, it just doesn't work, wants to get help with this from someone who's been there, done that herself and work with you, where should they go? Should they DM you, email you? Do you have a YouTube channel?
The best place to find me is Instagram. I share a lot of education around just the core and pelvic floor, how to function in life, just for women who want that strength and that feeling of I'm in control again. I'd love to drop my handle.
Yeah. What is your
That's it.
handle?
Yeah, so it's LLL underscore fitness underscore Leslie Harris.
All right. So if they send you a message, you will get back to them ASAP.
ASAP. Yes, absolutely.
Awesome. Well, Leslie, thank you so much for this conversation and great to have you on the show.
Yes, I learned some golden nuggets from you. So I appreciate you having me on.
Yeah. See ya.
All right, bye.